My name is Dr. Scott Sigman. I'm an orthopedic surgeon, specializes in sports medicine. I always joke around, healer of knees and shoulders, left and right. Host of the Ortho Show podcast, chief medical officer and founder of OrthoLazer. Just a big fan of innovation in orthopedics. So the thing that brought me to sports medicine in particular is a very common story for orthopedic surgeons, which is an injury early on in high school and then in college as well. The idea of combining science with sports medicine and healing was very appealing for me. And since 10th grade of high school, that was my goal. And here I am 25 years into practice. Surgical training back in the day, 25 years ago, it was really all about experience-based medicine being passed down from a mentor to a mentee, time in a cadaver lab, trying to learn new techniques as well. But it was really about getting the reps, really getting the repetition to be able to get to the level where you understood. And I think as a general rule, most programs do a very good job in training you to be a good surgeon, not teaching you how to do surgery. I think that there's a big focus for PrecisionOS on training in particular. And a lot of that focus has been on residents and fellows. But what I think, was really going to be remarkable is for surgeons that are already in practice for years who are thinking about trying a new operation. So for example, I wanted to learn arthroscopic laude. I went to Annecy, France with Dr. Laurent Lafosse, worked in his operating room, Matt Ravenscroft in Manchester, England, Paul Favorito in Cincinnati, Ohio, went to something like 10 labs and then studied film for 100 hours before I was able to do my first live course or first live surgery. So think about that. For an established surgeon who now wants to try a new technique, go down into your base, put on your goggles, and do your reps over and over again to the point where you're comfortable with the manual dexterity of doing that surgery. It's a leap forward in surgeon education, not just for those fresh out of school, but also for established surgeons as well. I think the three key advantages of surgical VR training is, first and foremost, is being able to get repetition. You can repeat over and over and over again in the comfort of your own home, rather than getting on an airplane or going to a lab. Three-dimensional learning versus two-dimensional learning. For example, just watching videos, for example, and then getting the manual dexterity, the haptics of understanding of how it feels in space when you're physically doing the surgery, and being able to get those multiple reps to get you to the point where you're comfortable with the surgery. So I think it's very important to include VR in the curriculum of surgical training. It's not going to supplant, it's going to add. Do you still need cadaver work? Absolutely, I still think you need cadaver work. But working with a master surgeon who's put together a protocol that you can follow, be able to then go through a few reps to understand and get a feel, move to the cadaver, and then eventually move to the human being as you're doing your training. I think it's a wonderful addition to surgical education. So if I were going to sit down, for example, with an orthopedic resident who's in training and talking about what PrecisionOS brings to the table in particular, I would say this does not supplant your training. It adds to your training, right? It's a safer environment to learn. You're not going to be injuring patients. You can go over and over again on a procedure to get to the point where you're feeling comfortable. I would spend time, but I would also spend time in the operating room assisting your faculty members, also spending time as far as cadaver work is concerned. And I think video learning can also be quite helpful as well. All of that preparation provides you the skills that you'll need to be an established surgeon. The most rewarding thing as an orthopedic surgeon is really watching people heal. That to me is the great passion of what I do. I've been in practice for 25 years. What I love about PrecisionOS as far as another tool to be able to help me to heal, improve patient outcomes, everything that we can, all hands on deck to improve those outcomes, allows us to do our job and sleep well. If I could talk to myself 25 years ago while I was still a resident and trying to absorb as much information as I could, what I would say is I would have done a little bit more research, to be honest. I think that research is important. I think hands-on training is also super important as well. I think that I probably would have joined societies earlier on to be able to contribute to the education and advancement of orthopedic surgery rather than being so focused on finding a private practice position for sure. So, it's interesting. We have so much technology in our lives, right? You get into your Uber, they have a GPS. You have a smartphone that can basically control NASA satellites at this point. Why is it that technology has been slow to advance into the medical field? So I'm super proud to be a part of PrecisionOS, and the fact that we're using this as an educational tool. Technology is finally moving its way into the medical field, and we're super happy to be a part.